Instagram has ever taught you, yet your chest still looks the same, you're not alone. Dear men, you're not unfit. You are misdiagnosed. If you're here because you've tried dieting, gymming, chest day, protein shakes, running, and every fat burning trick Instagram has ever taught you, yet your chest still looks the same, you're not alone. And more importantly, you're not doing anything wrong. Hi, this is your perfectionist plastic surgeon, Dr. Priya Bansal, and I'm here to serve the uncomfortable truth most men never hear. If it's gynecomastia, no amount of exercise will flatten your chest. Because you're not fighting fat, you are fighting glandular tissue. So, what exactly is gynecomastia? Gynecomastia isn't obesity. Dear men, you're not unfit. You are misdiagnosed. And no one told you. If it was just fat, I'd tell you to keep working out. But it isn't. And that changes everything. It is a hormonal imbalance that causes the male breast gland to enlarge. This gland, it feels rubbery, it feels firm, and this does not shrink with weight loss. And that is why losing fat may make your arms and your waist smaller, but the chest still sticks out. How the surgeons diagnose it? Now, during your consultation, we will first differentiate whether your chest fullness is mostly fat, mostly gland, or a combination. This is done by assessing the tissues, the firmness of the tissue, the location of the tissue, how it sits under the nipple, the mobility, and all of these. And then we determine the grade of gynecomastia from mild, puffy nipples to larger breasts with skin excess. This helps us create a personalized surgical plan with the right mix of liposuction gland removal or skin removal as well to ensure a flatter, more masculine chest. So, what actually works? Now, gynecomastia surgery, this is done under local or general anesthesia depending on the severity. First, we give a tiny incision at the lateral chest wall, and through this incision, we do a liposuction and remove the fat and also break the gland and remove that gland from the small incision itself. Sometimes the gland can be tough, and through this small incision, with the help of a forceps, we pull the gland, and it is excised from that small incision itself. Now, for heavier grades, the skin may need to be tightened. And in this case, either we take a periareolar incision and remove a little bit of skin around the areola, or we do an elliptical skin excision which will leave you with a scar in the underchest region. Now, depending on the degree of gynecomastia, the surgery can take somewhere between 45 minutes to 1.5 hours. Most of the patients, they go home the same day. You can expect some degree of swelling and soreness for a few days, which gradually keeps going down. The swelling maximum of it goes down by 6 weeks time, and complete swelling takes around 6 months to go. Compression garments are a must for 4 to 6 weeks for best contouring. You can resume normal activities in 24 to 48 hours. You can resume workouts from 7 to 10 days. Your final results, they become visible over a period of 4 to 6 months. Most men, they say the same thing after surgery. I wish I hadn't wasted years trying everything else first. So if you've lived with embarrassment, avoided fitted shirts, or slouched to hide your chest, please know this: gynecomastia is treatable and the results can be life-changing. A confident chest isn't always built in the gym. Sometimes it's built in the operating room.